Good morning, everyone. Welcome to Lunch with a Scientist. I'm Leah from Headwaters Science Institute. And as you know, this is your chance to meet a new scientist. We took a break last week and we hope you looked at our talk archives and saw some of our past talks. And now today we are back with you with Dr. Jess Goddard. So Jess has a BA in English Literature from UC Berkeley and a Master's of Science in Civil Environmental Engineering, and a Master's of Science in Energy and Resources, also from UC Berkeley. And she recently completed her PhD at the Energy and Resources Group at UC Berkeley in 2019. She also worked as a researcher with Cal EPA's Office of Environmental Health Hazard Assessment, where she co-developed metrics for water affordability in the state's first comprehensive human right to water tracking tool. So her research interests include water access and environmental justice, water quality and water systems, environmental health, and ecological economics. She currently oversees research and data science as the Chief Science Officer of SimpleLab, a Berkeley-based environmental testing startup focused on water quality testing and data. So today she's going to join us to talk about measuring water affordability as a human right, give some insights from the state of California. So welcome, Jess. Hi,
Hi, everyone. Great. Thanks for having me, Leah.
You're very welcome. And just so you're not deceived in our digital audience, Jess does work on insights from California, but she's actually talking to us from somewhere else today. Where are you, Jess?
I'm based in Baltimore right now. I moved here when my partner got a job. He's also a water person. He studies water chemistry as a professor at Hopkins. So we're on the East Coast today.
Great. So hello from afar.
Yes.
All right. Well, I'm going to turn it over to you, and we're excited to see your talk.
Great. Thanks so much for having me. I'm really excited to talk today to everyone virtually. The new world. And as Leah introduced, I'm going to be talking about water affordability in California, which is where I did my dissertation and a couple of other degrees, as was mentioned. And my current work, interestingly, is different, but some of the skills are the same. So I think one of the things that I'm going to talk to you about today as a social scientist is the way that we think about and use data that exists out in the world to answer questions that we care about for social and environmental reasons. In my case, looking at the affordability of drinking water in California. So before I begin, though, I thought I would just lay out the truth, which is that I have had a very nonlinear path as a scientist. I started looking at climate change ecology when I was doing my English degree at Berkeley. And I became fascinated by the way that people impact environments. And this really led me to want to study at that intersection between the environmental systems and the human systems that impact them, especially through technology. And that's what got me really interested in water, everything from looking at wastewater in India to drinking water access in Mexico. And in that path, I really started asking questions about the resource distribution. So who gets water and why and for how much? And all of these questions that I've had really have required me to look into disciplines like environmental engineering to understand how we clean water in our ecosystems so that we can drink it, and economics and political economy to understand why we make the decisions that we make. And that's what led me to a graduate program, which is traditionally called interdisciplinary. But I like the term undisciplinarity, which is from a paper from Sustainability Science, where the authors are talking about problem-based, emergent, and reflexive science. And what this really means is that you look at a problem in the world and you say, what do I need to do to answer that problem? And it's typically, if it's a complex system like environmental or social systems, it's going to require a lot of different disciplines at the table. And another really big component of this is collaboration and partnership with people who are not necessarily in the lab or in the academic setting, but also in policy. So I'm going to set the scene now to talk about water, and I'm going to give you a little background on my dissertation and then dive into one of the main projects that I focused on. So as of the last count in 2019, 2.1 billion people around the world lack access to safe drinking water. And this doesn't even include people who are actually don't have access to clean tap water like we might have in the US in many places, but also are forced to drink bottled water. And this has really motivated an international consensus around water as potentially a human right. And there's a lot of debate about it, but the goal of many countries has been to say that we as humans require safe and affordable drinking water. We want to institute that as an international goal. And from the human rights kind of framework came a set of goals called the Sustainable Development Goals, which the international community is working towards across a variety of social and environmental challenges. And Sustainable Development Goal 6 is about setting that target for trying to get people access to safe and affordable drinking water. And what I'm really going to talk about that was the kind of a core of my dissertation was how do we actually understand that? If our goal and our target is to have safe and affordable drinking water for people, what do we mean by that? And how do we actually measure it? And surprisingly, I found that in these documents, which you can look up online, where all these hundreds of countries come together and are putting forward their goals and targets, there's not a clear target for the affordability of drinking water. And there's also not a lot of conversation about the sustainability of household water choices when it comes to getting drinking water. So that led me to my research, which was really focused on measures of household water access, focused on equity and sustainability issues. And I'm going to focus mainly on the equity today, but I'll just give you the high level now. The first set of measures that I looked at was asking what the climate impacts were of bottled water in Mexico. The picture that you see here, these are these large plastic bottles called garrafones, and they are the primary drinking water source for most families across urban Mexico. So I worked with some of my colleagues in my department as part of a project with the Inter-American Development Bank to develop measures of, well, what is the climate impact of this plastic bottle as it goes through a typical household? So that was the first kind of measure that I was interested in building. And those measures could be used then as part of a climate mitigation project nationwide as a tool for trying to understand how they can reduce emissions associated with drinking water in households through a loan process. And what I'm going to focus on today is water affordability in California. And this was another co-produced project where I was working in the university with colleagues in the Office of Environmental Health Hazard Assessment. I'm going to call it OEHA for short. And in this project, we were really interested in understanding how we could measure water affordability and other things that make water a human right. So I'm going to dive in and give you a little context, because the first number I presented was about the global lack of access to drinking water. And we might think, like, is this really a problem in the US? It's such a wealthy country, let alone California, which is has a very, very powerful economy. Are people really struggling with this? But when I started graduate school, there actually was a lot of reporting on water affordability becoming a crisis in certain areas. And what this looks like were places like Detroit and Baltimore, where water bills were not, when people couldn't pay their water bills, they're getting their water shut off. And this was happening in the thousands, leading to protests in cities like Detroit. And as you can see in this last image here, water is a human right is a placard that's being used in a protest against shutoffs in Detroit. And what that really helps us understand here is how the human right to water is kind of used as an aspirational goal by people that are trying to seek safe and affordable water within the US. And if we look at some of the data that we have on prices of things over time, we actually see that water bills and water and sewer service bills have grown 3 times faster than inflation over the last several decades. And what this basically means, this blue line on the axis here is showing water and sewer prices, and the gray line is showing the price of all other types of goods that you could get. So what we see is that water and sewer prices are actually increasing much faster than other goods. And an important other component here is that people's incomes on average haven't changed very much. So the cost of purchasing water from your utility that gets to your tap has become harder for people overall. And California has been at the forefront of this kind of movement to thinking about how do we implement a human right to water at a state level. And in 2012, they declared water a human right. What does this mean? It means that water that is safe, clean, affordable, and accessible is actually something that the state promises everyone in California, and this is now embedded in the law and in the water code within the state. But as I've kind of been driving at, we have these goals and they're really laudable, but what does it actually mean? How do we know whether or not we're meeting these goals, and what kind of data and information do we need to actually say water is affordable or not? So that's what I spent most of the last 5 years working on. Sorry about that bell, hold on. And so that's what I spent the last several years working on, and with colleagues at OEHA. And we put out several reports, one called Achieving the Human Right to Water in California, where we researched what kind of data exists on water access, in my case, affordability. What do people want to talk about for affordability? We had meetings with the public around the kind of data and information we were interested in. This is a picture of me in the state of California in Sacramento, hosting an event about the issue with my colleagues. And we developed indicators and conducted statistical analysis on the data that we had. So that's kind of to give you a sense of the type of methods that are used in this work. So let's get to it. Affordability is intuitive, but it's difficult to define. You probably know what it feels like when you can't afford something, but you want it. And in the case of water, we're often talking about something that you can't afford, but you absolutely need it. So we first started by looking at the literature, and I'm not going to go into the details of a literature review process, although I'm happy to answer questions about it. But we were really interested to know, what do we want our measures of affordability to actually capture? And some of the things that we came up with were the fact that all types of costs matter for affordability. So typically when you pay for water, you get a bill from your utility. But if you're also purchasing bottled water, that cost counts towards your total affordability. We also don't want people to be paying for safe water at the expense of paying for something else that's really essential. So if you get a medical bill and your water bill and you say, I'm going to pay my water bill with this money that I have, but I'm not going to pay my medical bill, then we can't really say that that's affordable. We also, in the human right to water context, want to think about equity and non-discrimination, and this can look like many different things, but part of the goal is to really think about how are lower income or other communities that have been historically marginalized getting impacted by affordability challenges. And finally, we don't necessarily want to think about affordability of someone filling up a swimming pool. This is a luxury item. And so in the human right to water context, we think about the basic kind of amount of water that's needed. And this impacts bigger topics like the ecological sustainability of drinking water. So the first research question that I'm going to present, I'm going to show you my research questions. So the first is really, is water affordability a challenge for households in community water systems? So community water systems are water systems that serve at least 25 people or 15 connections. About a majority, almost I think 90 to 95% of people in the state of California get their drinking water from a community water system. And all of these purple areas here are reflecting the variety of different shapes and sizes across the state. And we also were interested in how water affordability might vary by size of system. So what this image doesn't represent super well, but you can see a variation in size categories, is that there are many, many small systems across the state. about 62% of systems are serving below 500 people, whereas some systems like Los Angeles Department of Water and Power serve 4.4 million people around. So we know that there are really different capacities of systems to bill households in different ways. So just as an example, a small system might really only have a tiny amount of infrastructure that requires 1 or 2 people to manage and make sure that the water is being treated and fill out all the paperwork for regulations and answer surveys. But a huge water system that has serving millions of people, like Met right here, has an enormous amount of technology, requires tons of employees and managers and engineers. So, even though my research is looking at the scale of a water system and thinking about households within the system, it's important to really keep in mind how different these water systems can be. So that's why I'm showing you some pictures, because the rest is more data and numbers. So I've talked a lot about the problem motivation and what we want to get at, and I'm going to give you insight into how we decided to measure affordability. So we decided that for each water system, we were going to develop 3 affordability ratios. And this was a fallout of a lot of extensive literature and conversations with different people within the agency, California EPA, ZOEHA, and Berkeley. And what an affordability ratio is it's really a measure of how much a water bill is relative to an income level. And because we were looking at the community water system, we wanted to think about these questions of equity and lower income households. So we chose to create 3 income levels. We looked at water bills as they relate to 3 different income levels, which I'll talk about. We also got water bill data through a survey that the state conducts. So these are reported water bills that water systems say people pay. And then this ratio is typically compared to a number, which is considered a threshold. And this threshold kind of lets you say, is it affordable or not? And there's a lot of debate about what the number should be. And I think that one of the contributions of our conversation around this has really been that we want to look at these trends over time and not focus on something being affordable or not affordable in a binary way. Some important components to this work of developing these ratios is that we focused on a specific set amount of drinking water that we felt reflected other priorities in California around household drinking water. So every month, every water system for which we had data, we had a reported water bill for 600 cubic feet per month. So that, if you were in a household of 4, that's about 38 gallons. So the concept here is that we wanted to focus on basic needs in a human right to water construct and not be providing affordability for excessive uses of water like a swimming pool, etc. As I mentioned, for the income level, which I'll get into detail soon, we also looked at the percentage of households in poverty within each system, because we were really focused on building a picture of some of the more economically vulnerable households. So as a summary, these 3 ratios were evaluated for the same water bill at the median household income level, which means that for every water system, we calculated what the 50th percentile of the household earns within the system. We also compared the water bill to the county poverty threshold of that system, as well as deep poverty, which is 50% of the California poverty level. So as you can see, these income levels range quite a bit. So across the systems where we had data, the median household income ranges from $17,000 up to the maximum that is reported in the census. And to give you a sense of the county poverty levels and deep poverty, these are closer to $23,000 a year to $36,000 a year, and half that for deep poverty. And it might seem these numbers are produced by the Public Policy Institute of California as a representation at the county poverty level of the income required within the county for a family of 4 to stay out of poverty. So we felt that this really reflected a lower income household where we'd want to think about, is affordability a challenge for someone in that system receiving a water bill? And we also looked at how many households within the systems were actually below or at or below these thresholds so that we could get a sense of the scale of the challenge. So ideally, I would go from presenting these ratios to showing you our data, but I want to just stop for a quick second and mention that secondary data, which is the surveys that we are working with. We worked with the census data to get income levels. We worked with a state survey of water systems to get the water bill data. And unfortunately, a lot of data, when you don't collect it yourself, is incomplete. And it can also be unreliable. So we did a lot of thinking about how to present the information, how to think about it, and we used some statistical tools to kind of evaluate how biased might our sample be because we're missing quite a bit of data. So about 52% of the systems in the state, of which there are 2,900, had data, and the rest did not report water bills in this survey. So we had to really think about, is this sample represent the actual kind of state of water systems across California? And what we found is that very small systems were more likely to not report their water, but the bias was kind of moderate. So I can answer questions about it, but I think that it's kind of an important piece of any work where you're interested in using data. It's extremely expensive to go out and try and survey everyone. So ideally, you actually design studies where you have a representative sample. But when you're working in a government context and you want to work with the public data that's been created, you have to deal with some of these challenges. So nonetheless, we were able to look at some really interesting trends, and we did a bunch of work to actually try and figure out, well, if we think that the data is unreliable, what happens to the trends when we take this data out? Do they stay? And everything I'm going to present to you today pretty much was consistent with a lot of our checks of the quality of the data. Okay, so the first finding I want to point out is that water bills vary a lot, and they are highest in smaller systems. So what this plot is showing, this is a box plot, and on the y-axis, I'm showing water bills for the same volume of water, which is that 600 cubic feet per month. And then each box represents a distribution of data. So, and they're divided up by system size. So the purple is the very small systems and the dark blue is the large systems. The black line in the middle is the 50th percentile. So that means that if you look at the black line, all the data above the black line is for 50% of the systems in this category, and all the data below is 50%. So you can see that the black line for the very small systems serving less than 500 people is much higher than the very large systems. So, and now I'm going to show you the affordability ratio results. So when we took that data about the water bills and compared it to 3 different income levels across systems, we get our affordability ratio. So the first thing I want to point out is that households at the county poverty threshold have relatively unaffordable water. And what I mean by this is that 50% of systems at the county poverty level had water bills that exceeded standards for systems that are considered low income in the state of California. The typical threshold used in lower income systems has been 1.5%. So when a system's water bill is in excess of that for the median, it's actually considered unaffordable at the state level. And so when we're looking at that threshold at the county poverty level, we can see that there's a challenge here. So this graph here is a histogram, and it's just a frequency plot. So you can see the number of systems on the y-axis and the affordability ratios on the right, and the different colors represent the different income levels. So the second observation here is really that the median household income levels, systems at the median household income have affordability ratios that are much lower. The median is about 0.9%. And this is consistent with international literature that looks at water bills and income levels and usually finds at the median that people are paying about 1%. So this is kind of considered affordable. And then, of course, for households in deep poverty, which is this darker blue distribution, the amounts of that people are paying is as a portion of their income is much higher. And of course, we would expect this, but you don't always know because income levels really they vary, and the water bill levels vary quite a bit across the state. So, I think that what you can really start to see too is that 3% has been a threshold that people have talked about for poverty level incomes across the world as being a threshold on affordability. And of course, households in deep poverty really are struggling not only with their water bills, but many other things as well. But from the standpoint of, a water system or a state trying to track the human right to water, we need to represent these problems to be able to see the differences. Because the other thing to recall is that each of these income levels is within one system. So you can look at 3 different income levels within a system and see the inequalities that our people are experiencing. And the second research question I brought up today was, well, does this vary by system size? Because we know that these smaller systems have often a lower capacity, financial capacity to maintain and manage systems, and just less people power to begin with. And so what I'm showing here is a similar box plot graph, and except this time it's of affordability ratios. And what we found was that affordability ratios are significantly higher in small and very small systems at every income level. So the affordability ratio is on the y-axis, and the 3 income levels are on the x-axis, and I'm breaking the boxes apart by system size again. So you saw earlier that smaller water systems have higher water bills for 600 cubic feet. But the fact is, especially with the median household income, many small systems are actually very wealthy in California, and some are not. So it's really not clear what the trend was going to be in the context of median household income. But the trend sort of persists. And this has different policy implications for how a system can manage an affordability challenge, because people's water bills tend to support the technical operation of the system to provide clean drinking water. And so if many, many people within the system are struggling to pay their bills, that can implicate the system's ability to handle the problem. And I'm going to show you another graph. This is a different way of looking at the frequency of events. And so what I'm showing here is the affordability ratio just for the county poverty level across systems, as compared with, on the x-axis, the percentage of households that are at or below that income level within the system. And the darker the hexagon here, the more systems that are actually observed in that spot. So one of the first observations when we started looking at some of these relationships is that many systems actually have a high percentage of households in poverty. We know across the state that the average is about 20% for this indicator that the Public Policy Institute comes up with. But they might have relatively affordable water. So I'm sort of trying to highlight here just qualitatively households that are paying, below 1.5%, but might have a lot of households in poverty. But there are also critical systems where you see higher percentage of households in poverty on average, but high affordability ratios, meaning that water is less affordable for those households. And because this is broken up by system size, you can also see that it's going to be a very different conversation from a policy perspective when you're looking at a very small system with this context or a very large system, because the number of people impacted by a system serving more than 10,000 people is a lot higher. So I'm going to walk us through some takeaways from this work. Our goal was really to measure affordability and try and represent it given publicly available data. and in the context of the human right to water. And we found that small systems have the highest bills and affordability ratios. Of course, this was within our sample. And poverty level households really face affordability challenges regardless of system size. And this was the case when we looked into some of the larger systems as well. And it's important to point out that really all of this work that we did is an underestimation of the problem. So water and sanitation and hygiene is actually the preferred way of thinking about the human right to water. Whereas we just looked at drinking water bills, but we know that sewer bills and stormwater bills, which are utilities' effort to try and raise money to actually clean and protect the environment in some ways, these are also bills that households are paying that we didn't have access to in this study. So we know that unfortunately, our estimates of affordability are likely underestimating the scope of the problem. And finally, data challenges were pretty persistent, and I didn't dig into it, but as you could see, we had about 52% of systems reporting data, which makes it really challenging for the state to identify which systems might have households that are struggling within them. Although there are some really great efforts, especially at UCLA and at the Water Board, to think about low-income rate assistance for people across the state. And this project, as I told you at the beginning, is part of a larger effort to track the human right to water. So I'm just showing some screenshots of the website, which I can post on the YouTube, where we created a tool. And what you see in the bottom right picture is just an example where you can actually see the variety of indicators. We have 3 for affordability, which I presented today, but also several for accessibility and water quality, because we really want to think about water access holistically. If you have affordable water, but it's not safe to drink, that's not an okay situation. So this is part of that broader project, and I encourage you to look up your area if you live in California. And it's also been an ongoing public process. So we had a concept report that we put out. We then put out, we got public feedback. We then put out the report with all the data that I showed you today and more. And then we went through a series of public events, webinars, academic expert workshops, technical forums, and community workshops across the state. And the team at AWIHA cares a lot about really representing what people care about and trying to understand, do you understand the tool and what makes sense and what doesn't and what would you change? So that's been a really fun process because science doesn't have to be done in the ivory tower. It can be in combination and collaboration with people, which creates new questions that you might not have come up with on your own. So with that, I'm going to wrap up, and I decided to leave up this really large acknowledgement list of people, collaborators, committee members, and my academic community and funding, because science really is a team sport. It's not something that you end up ever being able to do alone, even though there's the kind of image of a scientist working alone at a lab bench. This is really changing. And when you work on complex issues like the environment or resources such as water, you just, as one person, you can't handle all the problems that exist. So you have to work in teams. So I just want to point that out and say thank you to Leah and the Headwaters Science Institute. And I look forward to answering any of your questions. Thanks.
Thank you so much, Jess.
You're welcome.
That was great. I think it's a really key thing to study accessibility of all these vital resources in our world. So thank you for presenting.
You're welcome. It was a pleasure.
So I want to kick us off with a question here. I know if you could have had all the time in the world, you would have covered the other facets of accessibility as well. But if you could just get into it for a second, I wondered about water quality. And when you looked at that, if that correlated in a similar way to certain income areas or certain geographical areas?
It's a great question. We actually haven't done like the social equity analysis with water quality yet, although that's part of the plan to look at this. But I can answer you from my understanding of that problem in California, because actually Catalina Balez, who I worked with and who led this project, her dissertation work was similar, but looking at nitrates instead of like affordability challenges. So we've seen, for example, that in systems across the state, we really have a strong trend of water quality challenges in the Central Valley. And this is also emerging in the Central Coast as well. And so, and the types of contaminants differ. So in the Central Valley, there's actually a lot of exposure to nitrates because of the farm communities there. And unfortunately, these impacts are not equal. So we see a disproportionate impact of water quality issues in Central Valley on communities that are primarily identified as Hispanic. And in the Central Coast, there's also been nitrate problems as well as chromium. So, and unfortunately, the state has been aware of this challenge for a long time. We know that there are actually 1 million people in the state being served by water systems that have had some kind of violation. And the smaller systems have really struggled to kind of keep up with regulation, mainly from a kind of technical, managerial, and financial capacity standpoint.
Interesting. So we have a question actually coming in about those small systems you just mentioned. This is Spencer Houston, our program director. He wants to know, do you know anything about why some of these small water systems are so much more expensive?
Yeah. So when you say more expensive, I'm assuming you mean have the higher water bills for the same amount of water. So I actually would really like to do a more statistical analysis of that to understand all the factors, but some of the things that we know are, from a very basic level, is an economy of scale problem. So you just have less water that you're processing for the same amount of potential treatment technology and needs as like a more medium-sized system. So that's one challenge. The other is that actually not all water systems in the state are metered yet, and so there's actually a lot of like fixed price billing that happens. I didn't get into the rate structure component of water bills, but it's often that you pay a certain amount for a little bit and then you pay more and more depending on how much you consume. But if you don't have a meter, you're just going to get a fixed rate. So part of my work, I also called and talked to over 100 systems to ask them about their water rates. And in the smaller systems, it was often that either they had been billing this way for a long time, or they sometimes ran into a problem and suddenly needed to recuperate a lot of costs and didn't necessarily have like a long-term capital fee. So you could go from a situation where people are paying not a lot to, okay, we had to drill a new well, so our water bills are now trying to recuperate those costs. Mm-hmm. Those are some of the things that would be good hypotheses to investigate more.
And so do you know anything about the user end of this when there is a low-income family or a community of low-income residents that can't afford their water bills? Do you know what the fallout of that looks like?
So some of the research that has been more household scale, so like we've been looking at the water systems from this kind of bird's eye view of the state. But there has been some work done recently in Detroit and also actually in California a while ago. So there's a couple things that happen. People, depending on where you live in the country, it depends on what the policy is of the utility. But in places like Detroit and Baltimore, as I mentioned, there's been shutoffs is like one of the main tools of utilities to try and incentivize people to pay bills. However, when you talk to utilities, they tend to really try and wait as long as possible before doing something like this. So they'll send notices. So as a family, I mean, it's really, really heartbreaking, actually, because if you can't pay your water and you start getting notifications about your water potentially getting shut off, research just came out this year looking at the stress impacts of this in certain houses, and the water notification and the actual affordability challenge and the shutoff were seen as like significant drivers of psychological distress in households. So, ideally the utility is waiting as much as possible, trying to do a payment plan or something like that. But sometimes shutoffs are what's happening. In California, there's been an effort to actually eliminate this as a strategy altogether, because in a human right to water context, you should never have your water shut off for the inability to pay. The other component to that answer is that households might be able to be eligible for low-income rate assistance programs or customer assistance programs. This exists in many utilities across California and the US, but sometimes it's actually really difficult to get people enrolled or have people be aware of it. So I think the Water Board put out a stat that 20% of eligible households were actually enrolled in one of these customer assistance programs. And as I mentioned, the UCLA team, Gregory Pierce and others at the State Water Board have been designing low-income rate assistance policy to address some of these broader challenges and respond to the fact that what has been happening isn't really working so far.
Mm-hmm. Totally makes sense. And I think that we're all sort of leaning towards feeling a lot of sympathy for the affordability piece of this topic. Here's our board member, Jack Holmes. Hi, Jack. Asking a very similar question to what you just touched on. Is there a political stomach or any kind of policy leaning towards a state tax baseline subsistence for the low-income systems?
That is a great question. I would say in California, I mean, I'm not an expert on the kind of like the history of water bonds and taxes, but in California, it tends to be more, I mean, obviously, like anywhere taxes are, as you put it, like people don't tend to have the stomach with them in a legislature, but we do see a lot of public support for funding that goes through like bonds, for example, to go towards utilities in a variety of different ways. So it's been part of the conversation. I know that in the low income rate assistance conversations, the question of like, how would we pay for this has been raised, and potentially another way of thinking about it is like an addition to your water bill. If you aren't low income, like paying a really nominal amount that goes towards lower income water bills. Although we've had a proposition for a long time that has prevented utilities from actually charging more than the amount of water that you consume. And so this has created a lot of challenges of moving money around through billing. So yeah, it's a great question, and I think something that would be kind of an easy solution for a lot of basic needs, not just water. My advisor Isha Ray and I have talked a lot about why is it that we have public funding and a tax base for things like public school systems, but not necessarily for other basic needs that we know are essential. That's a very open question.
Yes, yeah, and I think as we're watching, we're really wishing and hoping for some kind of solution sometime soon.
Yeah.
So I want to back up to maybe a little lighter side of the topic, your passion for this work and this research. And so I'd like to know how, from a young age, you ended up getting into this such a specific field and how you found this kind of research.
That's a great question. I couldn't dive too much into it in my first slide, but one of the things I was really trying to emphasize is that I have not been on a straight arrow line from, age 5, and then this is what I wanted to do. So I was really actually committed to the idea of becoming a doctor for a really long time. And I loved the concept of healing people and thinking about vulnerability and being a part of the healing process. And I ended up taking a year off in college for a variety of like fortunate accidents that led to me taking a year off, and I was spending time in South America. And I kind of became witness to a lot of environmental destruction of a way that I had never seen before. Mining hundreds of thousands of pipelines through the Amazon for oil extraction, kind of matched with extreme poverty. And after that year of being in different communities and really seeing kind of the effects of our global world, I just became really interested in trying to understand, like, why is our lifestyle in the US, which is so privileged, what are the consequences of that? And I think my interest in, like, what are the consequences of the decisions we make and how we value nature and value people, which are part of nature, have just driven everything I've done. So I ended up I kind of came back to Berkeley after that year and said, I want to learn everything about the environment that I can. I worked on, became a research assistant for a professor in ecology. I volunteered at, kind of got paid and did internships at nonprofits and took lots of classes. And I think all of these things really allowed me to explore what I would feel the most excited about. And to just wrap that up, when I finished my master's degrees, which were intense, very technical, and also heavy on the literature, because I did kind of a more historical thesis and then a technical degree, it was like a kind of a beautiful timing where the PI of this project had been in a position to start analyzing this problem, and the law was passed the year that I started graduate school. So, in being able to ask kind of a driving question when the project that came up that really fit with it worked, I went for it. Also recognizing that, my interests change and continue to, and so I'm still motivated by those questions, but starting to now look at them from different angles as well. So, yeah.
Great. Thank you so much for talking us through that. It's a fascinating journey. And I think for the students watching and even the adults, it's the moral of the story really is that if you care about something, you can figure out a way to do something about it, which is really great.
Yeah, I think that's true. And being open-minded to the fact that what you end up kind of dedicating a lot of time to might not be what you had planned. Like, this was not planned. But I kind of realized, I was like, the people involved in this project have huge hearts and they really care about what they're doing. Like, it's a really interesting and challenging problem and there aren't good answers. Like, those are the kind of conditions that lead to really creativity and expansion of our understanding of the world. And so, as much as the problem is interesting, I think the people who you work with are really important too. And I cared a lot about that in selecting my dissertation focus.
Well, Dr. Jess Goddard, thank you so much for making us familiar with some of the complexities of water affordability and for offering us your insights. It was just really great to hear about your work. Thank you for being here.
Thank you so much. I'm happy to answer questions if anyone has more and wants to post on the YouTube.
Great. Yes, I do see some coming in, so we'll get those to you if there are any more. And otherwise, thank you so much. Have a great day.
Thank you so much, Leah.